How have testicular cancer chemotherapy regimens evolved? Imagine a time when testicular cancer was often a death sentence. Today, thanks to decades of research and clinical trials, it is one of the most treatable cancers. The journey of chemotherapy for testicular cancer has been remarkable, starting from very limited options to highly effective multi-drug protocols. In the early 1960s, doctors used single agents like actinomycin D, but these treatments had very low success rates, curing only about 5 to 10% of patients. Researchers soon realized that combining drugs could improve outcomes, leading to the development of combination chemotherapy. In the 1970s, the addition of cisplatin, a platinum-based drug, was a game changer. When cisplatin was combined with vinblastine and bleomycin, the regimen known as PVB cure rates for metastatic disease jumped to around 64 to 74%. This was a huge leap from earlier results. Pioneering studies in 1970 showed that using cisplatin-based treatments could increase cure rates from about 5% to over 60%. As more clinical trials took place, doctors refined these regimens to balance effectiveness with side effects. By the mid-1980s, the combination of bleomycin, etoposide, and cisplatin, called BEP, became the standard treatment. BEP offered higher cure rates and fewer side effects than earlier protocols. For patients with good prognosis disease, typically 3 cycles of BEP or 4 cycles of etoposide and cisplatin are now standard, leading to cure rates exceeding 90%. Even for those who relapse after initial treatment, salvage therapies involving high-dose chemotherapy and stem cell support have shown promising results, curing about half of these cases. The main idea behind these advances was to use drugs with different mechanisms of action and non-overlapping toxicities, which maximized cancer cell kill and prevented resistance. This approach also allowed for shorter, more tolerable treatment courses without sacrificing success. Over time, the focus has been on improving survival while reducing side effects, making testicular cancer a model for how targeted combination chemotherapy can turn a deadly disease into a highly curable one. Today, survival rates have soared from just a few percent in the early 1970s to over 80%, thanks to ongoing research and clinical trials. This evolution highlights the importance of scientific progress and personalized treatment plans, which continue to improve outcomes for patients with reproductive cancers. Always remember, individual cases vary, so it's essential to consult healthcare professionals for tailored advice.